just whether or not to repeal the Affordable Care Act. And I think it's important to note that this would walk back months and months of Republican promises to directly link repealing the Affordable Care Act with a replacement that would improve coverage, lower premiums, and be better for the American people. And in fact, Madam President, the President of the United States said that repeatedly over the last few months, that these would be inextricably linked, that repeal and replace would go hand in hand. That's not what is on offer right now. What's on offer is no more, for example.
Senators, please take your conversations off the floor.
What's on offer are specific, Madam President, what's on offer are specific changes that would actually harm Americans. For example, no more middle-class tax credits for health care. That's something that is critically important to the millions of middle-class folks who are walking on an economic tightrope every month, balancing their food costs against their fuel costs against their medical costs. And I was struck this morning, Madam President, when I heard that under this repeal approach, there's not going to be any real pain, that everything is just put off. Make no mistake about it. The pain for our families under this repeal measure is going to start right away. Nobody says they're going to be part of a marketplace if they believe it's not going to exist in a few years. 17 million fewer Americans are going to have health care 1 year from now. An analysis from the Congressional Budget Office, and this is only a week old, Madam President, said half of the country will have zero insurance choices in the private marketplace under this scheme. So I'd like to repeat that so that people understand that this idea that there's really no pain here and nothing starts for a long time, the Congressional Budget Office, our nonpartisan, impartial umpire, doesn't agree with that. They said just last week, half of the country will have zero insurance choices in the private marketplace under this scheme. That goes up to 75% of Americans with no options in later years. So my view is, Madam President, this is just legislative malpractice. First, because of the pain and harm it is going to cause so many Americans, and the Congressional Budget Office says that kind of misery is going to kick in quickly. And then second, Madam President, and I don't think this has been discussed on the floor, this walks back months and months of Republican promises. The American people were told again and again that repeal and replace were going to be directly linked. The president said it multiple times. And then he went over the top and told people that they were going to have lower costs and better coverage.
Oregon yield for a question?
Be happy to yield to my friend.
My friend from Oregon is pointing out that this legislation would impact virtually every American because in one way or another, we all interface with the healthcare system. This legislation, I would ask my friend to confirm, would impact what percentage of the United States economy?
We're talking, I would say to my colleague, the ranking member of the Budget Committee, we're talking about 1/6 of the American economy.
1/6 of the American economy. That's over $3 trillion every single year. Now, when we are dealing with legislation that impacts virtually every American, over $3 trillion every year, would my friend from Oregon please tell me, and I know that he is the ranking member of the Finance Committee and I'm on the Health, Education, Labor Committee, would my friend from Oregon tell me how many hearings have been held on the Finance Committee to discuss the economic implications of this legislation? Were there 5, 10, how many hearings on this enormously complicated and important issue?
My colleague is being logical, and heaven forbid that that should be introduced into this, because we would automatically assume that on a matter like this, where you're talking about 1/6 of the American economy, the Senate Finance Committee would have hearings. There have been no hearings.
No hearings. No hearings on a bill which impacts 1/6 of the American economy and every single American. Now, let me ask my friend from Oregon, obviously, before my Republican colleagues would go forward on radical legislation like this that would throw some 32 million Americans off of the health insurance they had, they obviously have consulted with doctors and hospitals to get their views as to the impact this legislation would have on patients and hospitals all over America. What kind of testimony did the doctors make on this bill, or the hospital administrators make?
I can tell my colleague, Senator Murray, and the two of us, the ranking member on the Budget Committee and I, have actually made public the overwhelming opposition from providers on this. So, in effect, providers and patients are standing together in opposition to this.
Right. So, if my understanding is correct, and I'm quite sure it is, the American Medical Association, not one of the great progressive groups in America, but the group that represents the physicians in this country. A, they have not been able to make testimony, but B, what is their view on this legislation? What do the doctors of America feel about this important legislation?
They are opposed, as I've indicated, and I think it is particularly important to see this provider-patient partnership that in this time is saying the patients come first and this bill hurts patients.
But we have not heard yet from one doctor making public testimony at a hearing. In other words, this bill has not said to doctors, what will this mean to your patients? What happens if 32 million people are thrown off of Medicaid? How many will get much sicker? How many of them will die? No test. What about hospitals? What kind of testimony have we heard from hospital administrators, those in rural America, about the impact of this legislation on rural hospitals in Vermont, rural hospitals in Oregon?
What I can tell my colleague is, again, those hospitals have not been in front of the Finance Committee. And one of the things that I appreciate about so many colleagues on this side of the aisle is they said, well, if we're not going to hear from these providers like the hospitals in the committee, we're going to go out to the country and listen to them. And I have had town hall meetings throughout rural Oregon, as my colleague Senator Merkley has, the rural hospitals that are the economic engine of so many rural communities. They are opposed to this legislation.
And let me ask my friend from Oregon, what kind of testimony have we heard as to the impact of this legislation on older working people in terms of what it might mean in increased premiums? Have we heard much discussion? Has the AARP, which is strongly opposed to this legislation, been able to come forward at a public hearing and express their point of view?
The AARP has also not been in front of the Senate Finance Committee, but I want to say again, senators have said if they're not going to be in front of the Senate Finance Committee, where we ought to actually hear testimony in line with the regular order, we're going to go out to the country and listen to AARP members and organizations, and they are overwhelmingly opposed to this because people between 55 and 64 would pay 5 times as much as younger people, and they would get fewer tax credits.
Well, Would my colleague please repeat that? I think it's important for older Americans to hear this. We had a candidate running for president of the United States named Donald Trump. And he ran all over this country and he said he's going to stand up for working families. He's going to stand up for the working class of this country. Please repeat what this legislation would mean if somebody were a 62-year-old worker in Vermont or in Oregon. What kind of premium increase might he or she see?
Hundreds and hundreds of dollars, and in a number of instances more. And the reality is, I think they're going to have a lot of trouble getting coverage at all. And the reality is, when you pour gasoline on the fires of uncertainty, and this is particularly important right now as plans are thinking about signing up, that makes it more likely you aren't going to have plans at all. Congressional Budget Office has also found this. The Paul legislation makes that worse.
Now, while the AARP and other senior groups have not been able to testify, would my friend from Oregon tell me what their views are on this particular legislation because of its impact on older workers and seniors in general?
While the senior groups have not been able to come before the Finance Committee to discuss this issue, I can say, and I've been working with a number of these organizations since my days with the Gray Panthers, they are overwhelmingly opposed to this. And I think in particular, this idea that we heard from the Congressional Budget Office last week that half the country will have zero insurance choices in the private marketplace under this repeal scheme, and it goes up, that will just cause even more seniors to be against it.
But it's not only older workers, because we have, as an aging population, more and more people in nursing homes. Would my friend from Oregon describe what happens under this legislation if somebody has a mom or a dad in a nursing home struggling with Alzheimer's or some other terrible illness?
Under this legislation, you would have a massive rollback of the Medicaid program. And so for all of those older people who scrimped and saved all their lives, they didn't take that vacation, they tried to make sure they could educate their kids, Medicaid picks up 2 out of 3 of the costs of 2 out of 3 nursing home beds in America. And this legislation would produce a massive rollback of the Medicaid program, and I believe so many older people are going to find long-term care unaffordable, millions.
I think it's important to repeat that because this is not something that I think most Americans are aware of. Medicaid now pays, as I understand it, for 2 out of 3 nursing home beds in this country. Is that correct?
That's correct.
And a massive cut in Medicaid would be devastating to those families who have loved ones in nursing homes.
That is correct, and it would be accompanied with further misery because it would leave millions suffering from opioid addiction. They would have nowhere to turn for coverage as a result of this massive rollback in Medicaid coverage under this amendment.
I've asked you a little bit about some of the cruel and devastating impacts this legislation would have, but we have to be honest and acknowledge that there are some beneficiaries in this legislation as well. Would my friend describe the beneficiaries in the House bill in particular? While millions were thrown off of Medicaid, while 23 million people lost their health insurance, some people actually did gain from that bill. We have to acknowledge that. Is that true?
Yeah, the fortunate few would benefit under the House bill. I mean, there's no question about it. To give you an idea how regressive those efforts are, they would actually be retroactive. So this idea that these tax cuts for the well-to-do were in some way going to create jobs, that's just absurd. They're made retroactive, so they aren't going to create any jobs going forward.
Correct me if I'm wrong, but my recollection is in the House bill, there were $300 billion in tax breaks going to the top 1% at exactly the same time that 23 million Americans were thrown off of their health insurance. Is that correct?
A few hundred families benefit so greatly that it could actually cover Medicaid expansion in several states.
Would the distinguished senator for Oregon allow me a question? And this is a very, very important debate. And on the point that you just made, isn't it correct that there is nothing in any of these versions that lowers the costs of prescription drugs, which is the #1 issue for people in this country as it relates to health care or for businesses? I hear it all the time, that nothing in here to lower the cost of prescription drugs, but there are tax cuts in here for the prescription drug companies. Is that correct?
That is correct. The special interests get very, very substantial tax breaks, and those working class people lose tax credits, so they actually lose, and in effect, those dollars can be used for the tax cuts for the fortunate.
And nothing to go further to use the buying power with Medicare to negotiate prescription drugs or to allow us with safe FDA approval to be for people in Michigan to be able to drive across the bridge to Windsor and be able to get the very same prescription drug for 40% less. Nothing in there about that. Is that correct?
There is nothing that would give Medicare bargaining power to make sure seniors got a better deal. Nothing for the kind of effort our colleague from Vermont and Senator Klobuchar have pursued, which would allow, under circumstances where there were safety precautions for pharmaceuticals to come from other countries, nothing to go after pharmaceutical middlemen. So yes, there is nothing in these bills to hold down the costs of pharmaceuticals.
If I could, let me ask my colleagues from Oregon or Michigan maybe to speculate here. If this bill, the House bill, were to be successful, which we're going to do everything in our power, in our ability to make sure it is not successful, and Medicaid was severely cut back, what do you think will eventually happen in the near future, not eventually, but in the short term, to programs like Medicare and Social Security? Would it be a reasonable assumption that this is the beginning of the effort on the part of the Koch brothers and Republicans in the Congress to begin dismantling virtually every federal program that helps working people? Is it not true that the House Budget Committee has already passed legislation that would move toward voucherizing Medicare and privatizing it?
My colleague is right. There is a very regressive effort going forward in the House Budget Committee, and clearly this is to try to set up tax cuts for the fortunate few. I was struck by the fact that the president has talked about a 15% corporate rate. You lose $100 billion for every point you lower the corporate rate. So the corporate rate is now 35%. You move it to 15. That's $2 trillion that goes out the door. So yes, I'm very troubled that the House effort plus this legislation is really an effort to begin the unraveling of America's social safety net, and that funds that provide for those very vulnerable people would be used for these additional tax breaks.
I wonder if the senators are aware in Michigan, and I share the senator from Vermont's deep concerns about those opportunities that people have paid into, by the way. This is not some free, this is not an entitlement. People pay in to Medicare, pay into Social Security, which has lifted a generation of seniors out of poverty, allowed seniors and people with disabilities to live longer because of Medicare, and it has created a better quality of life. Medicaid, though, as well, there's a great success story I would share in Michigan on the Medicaid front. And of course, In Medicaid, talking about seniors as well, 3 out of 5 Michigan seniors in nursing homes, Alzheimer's or other kinds of challenges, get their health care from Medicaid. So in addition to Medicare, Medicaid is there for middle-class seniors, for low-income seniors, and so on. But there's another piece when our distinguished senator from Oregon talks about dollars, saving dollars or costing dollars. Michigan, an interesting thing has happened by setting up Healthy Michigan and expanding Medicaid health care to minimum wage working people. We're actually saving money. 97% of our children can now see a doctor in Michigan. Great. They've cut in half the number of people that walk into the emergency room that can't pay, because we all pay if somebody walks in, right, and gets the most expensive treatment through the emergency room. And the state of Michigan is now saving $432 million in taxpayer money next year because they're focusing on children going to a doctor, people getting preventative care, not using the emergency. So it saves money. So instead of doing these tax cut provisions for the wealthiest and for the pharmaceutical companies and so on that take dollars away, actually doing the right thing on health care in Michigan is a great success story for saving taxpayer dollars.
I think my colleague's making an important point, as well as my friend from Vermont. I mean, part of the reason that many Republicans want these tax cuts for the fortunate few is kind of arcane to people, pretty complicated. But what they really want to do is get them now to put them in the budget baseline in order to open up the opportunity when tax reform comes along to have even more tax breaks.